All right, here are my top 5 tips to manage swelling in your knee after your knee replacement. The number one way you can help is by elevating your leg. Elevating is specific though. It means laying with your leg in a straight line, with your ankle higher than your knee higher than your hip, and everything higher than your heart. So make sure when you're elevating, you are laying flat and you lift your legs up. It doesn't help if you're in a sitting position and your legs are straight out in front of you. That just creates a low point at your hips, and that's where you're going to get the bruising and the pooling of the swelling. Okay, second tip is to move. Do you know what a knee is? It's a hinge. It likes to open and close and open and close thousands of times a day. Now, after a knee replacement, this is not easy to do. So the less you move, the more the swelling can settle into the knee joint. Swelling will sit anywhere where there's room. And in a knee joint, there's quite a bit of room, especially now that you got rid of your arthritis. So gentle movement. We're not talking extreme bending and straightening. We want to move that knee gently, whether it's sitting on a stationary bike and swinging the knee back and forth, placing your foot on the ground and just sliding it back and forth on a slippery sock or a cookie sheet. Great place to start. Moving. That will help pump and push the fluid back out of the knee joint. And using those muscles also helps to pump and push the fluid out of the knee. This leads me into my third tip, and that is to use the muscles, muscle pumps. So when you're in bed, everyone learns how to do ankle pumps, thigh squeezes, and glute squeezes. Now, if you do ankle, thigh, glute, and then some deep breathing, it's like a little conveyor belt. You've pumped the muscles all the way from the toes down to the hips and then the core. And what does this do? It actually helps to pump the fluid and the swelling out of the leg. Combine this with elevation, and it's a game changer. So that's a good, powerful strategy to help reduce swelling in the knee. Muscle pumps with elevation. Okay, tip number 4 is to use compression. Some surgeons actually recommend wearing a compression stocking, something like a TED stocking it's called, but those can be very, very uncomfortable. So maybe it's not something you can wear all the time, but even a sock that goes up to just behind the knee, or if you can wear a thigh-high compression sock, even for just little periods of the day, that can help prevent fluid from wanting to pool in the leg. And my 5th recommendation for swelling relief is to massage or to gently create a little bit of lymphatic drainage. Lymph is one of the ways that your body removes and pulls fluid from different joints, moving from lymph node to lymph node. Now in your knee, you actually have some lymph nodes at the back of the knee. Your next closest lymph node towards the core is your groin. So you can imagine if you're gently pressing the fluid from your thigh towards your groin, that can help with some of the fluid removal.